We're going to focus on the neurodevelopmental conditions, which by definition actually start in the pediatric era. We are talking about neurodiversity, which is an interesting new concept. I hadn't heard the word until a few years ago. It refers to neurodevelopmental disorders or conditions, as we are preferred to call them now. It talks about the brain in evolution from birth to adolescence. We're going to quickly touch on the criteria in the DSM, the concept of essence, and then we're going to focus in part 2 on specific conditions in pediatrics. And I'm going to spend the most time on the autism spectrum condition, the attention deficit hyperactivity disorder, and then also on the DCD, or the developmental coordination disorder, which we so often actually neglect or don't think about, or sometimes don't even know about. So when we use the term neurodiversity, we actually referring to the neurobiology of a brain which is so-called differently wired. It's present since birth, it has a different anatomy, it has a different evolution. Even the pruning and the connections change throughout the course of life. It's very often we have different chemical balances, and this is where the medical management comes in. And it's usually a lifelong condition despite evolution over time. The neurodevelopmental disorders, because they're present since childhood, are capable of causing impairment in academic, social, interpersonal, and occupational functioning. And one of the reasons for this talk is that the early diagnosis and intervention can actually be life-changing for individuals and their families. We look at neurodiversity as a spectrum. We don't know what's going to come out on the other side. We have input, and sometimes we are surprised at the brightness or the dullness that's emitted. When we consider the diagnosis, we have to bear in mind the American Academy of Pediatrics Diagnostics and Statistics Manual. But more than that, we have to bear in mind the clinical interview and examination and observation. That is still number one, and it beats questionnaires, and it beats most of the validated tools. But at the end of the day, for medical aid purposes, for confirmation, for discussion with the parents, the teachers, and other professionals, we do have to make use of specific tools. They need to be validated, they need to be age-related, they can be interviews, observations, assessments, questionnaires, screening forms, checklists from various sources and institutions. But at the end of the day, it's the professionals involved, the therapists, the medical doctors, the psychiatrists, the psychologists, who actually make the diagnosis and ultimately manage the situation, the cases. So we're not talking about management and intervention. I hope we can do this in future. We are going to focus very briefly on the DSM. So we've had mental illnesses over all the ages: melancholia, mania, paranoia. We've had the DSM-1, 1952, 130 pages, biopsychosocial model, and so it went. 1968, 1980, 1980 brought in the multi-axial approach to diagnoses. Then there was a text revision. Then in 1994, they introduced the 13 work groups, so it became more evidence-based with the text revision. And then in 2013, there were major changes. The multi-axial system was removed, and there was an introduction of a classification system whereby the mental disorders are understood to exist along a spectrum with subtypes and specifiers. So it's not just the autism that we understand as autism spectrum. It's also all the other disorders that are understood to wax and wane throughout the lifetime and depending on the intervention and management. Major text revisions in March 2022. There were particularly the social issues which were revised. Gender and racial issues got new diagnoses. About 70 mental health disorders criteria were revised.